On March 23, 2010, President Barack Obama signed into law the Affordable Care Act, which had bold ambitions of improving the quality of health care, reducing costs, and improving access to health care services. The act was hopeful that it could control those costs through the use of health information technology. Health information technology is technology applied to health and healthcare. It supports health information management across computerized systems and the secure exchange of health information between consumers, providers, payers, and quality monitors. Health information technology will definitely improve patient care, but it can also result in many public health benefits, such as the improved monitoring and management of chronic healthcare conditions. This video will highlight 4 separate innovative technologies that are currently on the market and are being used to help deliver healthcare and healthcare services. Wearable technology is some type of technological device that can be worn by a consumer that either tracks their health and fitness data or helps assist with the management of a health condition. It helps increase communication for providers, and it helps to track information more effectively for consumers by increasing mobility. Wearable devices can help consumers study their own fitness data as well as offer data to providers and insurers that will help track the health outcomes of consumers. One of the greatest challenges for wearable medical devices is receiving approval from the Food and Drug Administration. In addition, other challenges are the security of the information as well as the cost and availability and battery life. There are several different types of wearables on the market, such as the armband, which is used to help track blood pressure, glasses to help diagnose underlying conditions, health patches to help administer medication. But the most common form is the wristband, with products such as the Fitbit that's used to help monitor heart rate and mobility. Leaders within the health information technology industry are still lukewarm on this new innovation. They believe that finding best practices will be difficult to implement, and they still believe that further research is needed on the benefits and use of this new technology. In 2008, Congress passed the Health Information Technology for Economic and Clinical Health Act as part of the American Recovery and Reinvestment Act. This act earmarked an estimated $19 billion in direct grants and financial incentives to promote the adoption of electronic health records by hospitals and physicians. Electronic health records are not an application that provide all of the necessary functionality, but rather a platform that enables it. They are a systemized collection of patient and population electronically stored health information in a digital format. These records can be shared across different healthcare settings. An electronic health record system can improve the quality of care of service delivery. Electronic health record systems allow physicians and staff to create patient charts, document patient visits, schedule appointments, electronically prescribe medications, coordinate care among multiple providers, generate bills for services, and much, much more. Electronic health records have the ability to show evidence-based medicine knowledge that can help to prevent errors and make suggestions for more effective treatments that would positively impact quality. They also allow a patient's health record to be easily viewed by multiple clinicians who may be on the care team but are not co-located. Additional benefits of electronic health records include that past and present prescription medications can now be viewed, which will help avoid dangerous interactions, ineffective prescriptions, as well as any allergic reactions. By utilizing electronic health records, several ongoing problems can be addressed within the industry, such as improving the quality, safety, and efficiency of care, engaging patients and their families, improving care coordination, improving population and public health, and ensuring privacy and protection for personal health information. Centers for Medicare and Medicaid Services provides payment incentives to eligible medical professionals and hospitals that have effectively demonstrated that they have engaged in adopting, implementing, or upgrading to electronic health record technology. Electronic health records are a major transition for any healthcare organization. It can be disruptive and transformative change for physicians. As long as the healthcare industry lacks true interoperability among its systems, clinicians will have incomplete patient information, so leaders are excited about the possibilities. Selecting an electronic health record system is a critical decision and a significant planning task. After determining the objectives and needs, a determination is then made on what to look for when selecting the system. Points to consider include server options, privacy and security capabilities, vendor stability, and linking payments. Electronic health records will improve practice communication, accountability, and increase patient satisfaction. Little post-it notes can now be done away with, as well as quick conversations as clinicians pass each other in the hallway. Software and practice management systems can be used to assign tasks with due dates to office staff. Health information exchanges allow doctors, clinicians, pharmacists, and other healthcare providers, in addition to the patient, to appropriately access a patient's medical information electronically. This improves the speed, efficiency, safety, and cost of patient care. Health information exchanges are a cloud-based system with a third-party auditor that can run control for unauthorized users, as well as give access to health providers and patients, all within one network. There are three key types of health information exchanges: directed exchange, query-based exchange, and consumer-mediated exchange. Directed exchange has the ability to send and receive secure information electronically between care providers to support coordinated care. Query-based exchange has the ability for providers to find and/or request information on a patient from other providers, and this is often used for unplanned care. Consumer-mediated exchange has the ability for patients to aggregate and control the use of their health information among providers. Despite the availability of electronic data transfer, most Americans' medical information is stored on paper. Patient health information is mostly stored within filing cabinets, and when that information is shared, it happens by mail, fax, or by patients themselves. Patients usually carry their information from doctor to doctor, which greatly diminishes the safety. Healthcare providers are rewarded for implementing programs to make interoperability and efficacy improve within their practices. Health information exchanges improve business efficiency. With the implementation of electronic exchanges, readmission and medical errors can now be easily avoided. Acquiring this technology might be one of the easiest, yet harder to obtain goals for more of the healthcare populace. Because it can be a costly venture, smaller businesses may have to use federal financial incentives to drive their demand for the health information exchange. Healthcare providers, patients, and clinicians are intrigued with the idea of using cloud computing for the purpose of health information exchange. There is a concern about the idea of protecting patients' privacy information, which makes interoperability a bit more complex and challenging. Telemedicine is an innovative type of healthcare that is being delivered through landline phones, computer monitors, and mobile devices. The first instance of telemedicine being used was in 1960, where practitioners provided medical assessments and psychological tracking to NASA astronauts. Improving patient care and satisfaction through collaborative communications, which includes mobile communications, automated outreach, and technologies for driving workflows, was a top priority for most healthcare technology workers, so they have been pleased with the use of telemedicine. Telemedicine makes certain job functions as a provider much easier. Within the field of obstetrics and gynecology, telemedicine has assisted with informing patients of ultrasound results, which usually requires an additional in-person appointment to be conducted. Because of low access to mental health care, practitioners within psychiatry and psychotherapy also rely heavily on the use of technology to procure treatment across long distances. Telemedicine has increased access to care that was previously unavailable, increased quality of life as well as quality of care, allowed family members to be involved with patient care, provided financial stability due to reduction in office visits, and expanded clinical resources over large distances. Telehealth implementation is a high government priority in the United States, United Kingdom, and Canada. However, several external factors can hinder the implementation of telemedicine, including a lack of management support, training and policies, a perceived lack of complexity and cost, as well as logistics. Telemedicine has already been acquired within the healthcare industry, and it is rapidly enhancing the field. Specialties are now becoming larger and more efficient thanks to this technology. Different areas of medicine can now communicate with each other to increase the quality of care for patients. The delivery of healthcare through information technology has drastically increased in the past several years, and most, if not all, specialties have transitioned to utilizing this field to improve patient quality of care, personal health information, and accessibility in rural areas. Information technology can act through mediums to deliver healthcare in several ways, including electronic health records, wearable technology, telemedicine, and health information exchanges. Each of these mediums can make the delivery of healthcare more efficient. The delivery of healthcare through information technology has revolutionized the medical field and will continue to do so in the years to come.